So as President Trump returns to the White House, coronavirus cases across the nation are on the rise. Nationwide, more than 7.5 million cases have been confirmed and more than 210,000 people have died. This comes as the White House is blocking strict new federal guidelines for the emergency release of coronavirus vaccine. So let's bring in pediatrician Dr. Dyan Hes. She's the founder of Gramercy Pediatrics. Doctor, President Trump is back at the White House after receiving several days of care and treatment. Can you walk us through what we know so far about the care that he received versus, the sort of care that an everyday American might receive if they find themselves so sick with the coronavirus that they are at the hospital?
So, he received a completely different level of care that anybody would get, because from what they were reporting and what they were giving him, we got two different messages, right? So the first, they said he's really not sick at all. This is all a precaution. But within the first day, he got remdesivir, which we know is reserved only for hospitalized patients who can get it based on compassionate use in very few hospitals in the United States. Now, I'm not saying that he shouldn't have got it because he is the leader of, the United States, but he cannot keep on saying on the news, you're going to beat this. This is nothing. He got steroids, which are reserved for people who are hypoxic, who are in severe respiratory distress. He has care around the clock. He got polyclonal antibodies from Regeneron, which is still in a study, and I hope that it did work, and it was the reason that he got better so quickly. But the average American and the average person in the world is not has no access to this. So it's completely misleading when he says, go back to your lives, do whatever you want, you're going to beat this. Because unless we all have access to those drugs, we're not going to beat this. Doctor, we're not going to beat this on the same playing level.
Doctor, in the video the president released, he makes a comment that maybe he's immune after declaring he feels better. Can someone who is still infected with the coronavirus be immune? What do we know about that?
No, it doesn't even make sense. He's probably still infected. Probably if you cultured him, he might have fragments of coronavirus in, RNA fragments still. But he's clearly not immune because he got coronavirus. I don't know that he knows the meaning of the word immune. Or maybe he misspoke. I know that we're on the news often. Sometimes I use the word wrong. Maybe he misspoke. He is not immune.
Yeah, and also, I'll say, he says he feels 20 years younger. Could that be a side effect of the steroids that they're giving him?
Yeah, definitely.
Okay,
for sure.
Just checking.
So the other thing sort of at issue is we still don't know the timeline of when the president may have contracted the virus. No one seems to be able to talk about when his first positive test was, when his last negative test was. So keeping that in mind, Joe Biden and the president had this debate. Joe Biden and his wife Jill have been tested frequently over the last few days, and they say their tests keep coming back negative. But is Joe Biden or anybody else who may have come in contact with the president, during that debate time, are they out of the woods?
I think by now they're out of the woods because we usually see that they would be catching it within 5 days. But, this is all hypothetical. This is something that we still don't know. We just, there's different messages now from the CDC that, it is airborne and it could travel further than 6 feet if you're in a very closed, tight space. The debate hall was quite large, and we know that Vice President Biden does wear his mask all the time unless he was debating at that point. So I think their risk is much less. I'm more interested in so you see the pictures of the Rose Garden, how close they were all sitting together. But I am more interested in if they were ever all indoors together. Was that whole group in a reception before and they moved it outside, or was it always outdoors? If they were inside, clearly nobody was wearing masks. If they caught it that quickly, was it from the airplane? Did they all travel together? And when he went to New Jersey and he knew one of his aides was tested, sick, he should have stayed home, regardless if it was coronavirus or not. Until he had those results, he should not have gotten on a plane and gone to New Jersey to a fundraiser, thereby exposing more people.
Right, and people who work, I know we talk a lot about the high-profile people that we're tracking, but there are, waiters and bartenders and people who attended both of those events who are now being asked to quarantine because of their health is now at risk. Doctor, the White House recently blocked the release of a new FDA guideline on emergency authorization of a coronavirus vaccine. The guidelines would make a vaccine available before Election Day nearly impossible. So what does this move mean for physicians treating patients now?
I mean, physicians want good science. Physicians are scientists by nature. We do not want anything rushed out because the White House says to rush it out. The vaccine community, the drug makers want to follow these patients who got the coronavirus vaccine for another 2 months to see that they don't have any side effects or are there any other untoward effects that we didn't know about. That's what you do. And that's even rushing. 2 months is rushing. So for the White House to say they don't want to wait 2 months, they want the vaccine released before these studies are done, it's so irresponsible. It makes me so sad because I feel like when I wake up in the morning, like this is a crazy movie. That we almost have a dictatorship and not, democracy where science is the law and rules and public health. I mean, rolling out a vaccine, I'm all for a vaccine. I want it tested. I want to know its efficacy, and I want to know that there's no side effects, as most of the American public does. And I really feel that if they roll this out coincidentally a day before the elections, nobody is going to want to take that vaccine because you're going to know it was rushed through.
You brought up something about the CDC acknowledging Monday that people can sometimes be infected with the coronavirus through airborne transmission, especially in enclosed spaces with inadequate ventilation. It's sort of another reversal for the CDC. And, I know that doctors often go to the CDC to sort of get the information on a myriad of different illnesses or conditions that maybe they, if they see something that they don't see very frequently in their office, they might double check with the CDC. So I just want to get from you, what is your take on the credibility of the organization? How do you feel as a doctor when you see this flip-flopping going on?
Oh, it's so ironic that you ask, Anne-Marie, because tonight I'm giving a lecture, and my specialty is pediatric obesity and physical fitness. So I was looking up the CDC guidelines for the recommendations for physical fitness for different ages. And then when I was looking it up, I was like, is this a credible source? We teach my son is in high school and he's learning about finding credible sources. And it's almost like your whole faith in the CDC, which was the gold standard, is now questionable. I feel that there is. I feel like we do have to question their rules about. Just like the WHO also flip-flopped. I just feel like there's too much politics involved in decision-making in public health, and until they are separated, and there should not be White House control over a scientific community, we have to, as scientists, question and raise our voices.
It's a great point that you make, Doctor. And, I'm just, again, looking back at the president's tweet with regards to flu season. Not only is he wrong about the number of people that succumb to the flu, I'm just going to read it here. He says, "Are we going to close down our country? No. We have learned to live with it, just like we are learning to live with COVID." It sounds like the president is not even concerned with getting rid of this pandemic. He's saying that we should just continue to have this pandemic within this country, just like we have the flu, because we've been unable to control the flu. So it is sort of mind-blowing that you as a scientist, you as a doctor, would look at the CDC and sort of doubt yourself, even having an inkling of doubt, whereas, a couple of years ago, that would have never happened. And that's where we are. Dr. Dyan Hes, always great to have you. We appreciate your insight. We appreciate your analysis. Thank you very much.
Thank you. Have a great day.
You too.